Dr. Rushnak, as you know, the Republicans are moving ahead right now, full speed ahead, to try to repeal what is commonly referred to as Obamacare. You and your organization have been pushing for more health care benefits for people in the United States. How do you read this move, and what do you think it's going to mean to the average person in the long run?
I think the move that the politicians are doing is purely political. I think that healthcare is about lives, it's about people, it's about saving lives, preventing suffering, preventing medical bankruptcies, doing the right thing to keep us healthy. We should crave healthcare. It's not political. American people have been brainwashed to believe that healthcare is about politics. It's about people. It's about healthcare professionals like myself, nurses, doctors, trying to help people live longer, productive lives. I would ask anyone listening to me now, who does not want to be healthier? Who does not want to live longer? Who does not want their children and their grandchildren to have a better life? That's what this is all about. This is not about the next election. This is about doing what's right for all of us, every American. We need health care. I've been a physician for 36 years, and I can tell you, and I'm a cancer survivor for 8, and I've been fortunate to have been lucky enough to have had health care. I want that for every American. The Hippocratic Oath, which I took one time, way back when, 36 years ago, said, save lives, and that's what this is about, saving lives. So all the political nonsense that you hear is about winning elections. I'm about saving lives. Americans for Healthcare is about doing what's right for Americans. We're all in this together. Let's work together. Let's come together. Doesn't matter what party you belong to. We're all people. This is what's right for humanity. Let's get it done. Let's come together. Look to physicians. Look to nurses. We have very, very high credibility in the American population. Trust us. Congress is at 11%. Why would you look at someone doing 11% when we have 99%? We are the ones you should look to, not Congress.
But in assessing this from a political standpoint, as distasteful as you may find that, the reality is that, as I understand it, you don't believe that a package that was passed went far enough in providing care for people who can't otherwise afford health insurance. And now the Republicans want to go in the opposite direction. Does that make your goal of expanding care to more Americans even the more difficult now under the current climate?
The answer to your question is the paradigm is wrong. We have a sickness care system in America today. We have world-class sickness care for those who are most wealthy. We do not have a health system, and we don't have prevention and wellness. We're ranked dead last, no pun intended, amongst industrialized countries in wellness and prevention. That saves money. There's more than enough money in the system right now to cover every man, woman, and child the right way. Physicians and nurses can help to design a healthcare system that will do that. The current system is dysfunctional. We need to get physicians and nurses involved in making the right decisions about healthcare. Then we'll be able to do the right thing. And then the American people will feel that they're all in this together, and they're not going to pay more money. They're not going to pay more taxes. And people will be happy with it because we're involved. And shame on the doctors and nurses for all the years for going back to our practices and taking care of our patients and not getting involved in public policy. I have a master's in public health. I've been involved in government. I understand what it takes to move mountains. This is like climbing Mount Everest because there's a lot of status quo, a lot of special interest involved in maintaining the status quo. To maintain the status quo that has left America 37th in the world by the World Health Organization. Not me saying that. WHO is saying we're just one country ahead of Slovenia. Does anyone know where Slovenia is? We just beat out Slovenia by the barest of margins, and yet we spend 10 times the amount of money they spend in Slovenia. There's something wrong with our system. We have to change the paradigm, let the doctors, let the nurses, and some fresh air get into our healthcare system to do the right thing. Not the current sickness system that we're under, but a health system. We can also learn from other countries. Many other countries have solved this problem. We are the last industrialized country on the face of the earth that is still facing whether or not that every American should have health care. It's a disgrace.
Put.
Hey, how are you?
My name's Casey Alvear.